Today in the recovery room, we are answering a question from Janice in Sioux City, Iowa. And Janice's question is, I've heard that the incidence of cancer is going down, but then why does it seem like so many more people are getting cancer? Great question. Janice is correct. The incidence of many types of cancers, including breast and prostate, are going down. But the actual prevalence and number of people being diagnosed with cancer every year is going up quite dramatically. Well, how can that be? And can it actually be partially as a result of good things happening in cancer care? I'm oncology physical therapy specialist, Dr. Leslie Waltke. You are in the recovery room. Let's figure that out. So how can the incidence of cancer be going down while the prevalence of cancer is going up? Well, the general answer is because incidence and prevalence are two different things. Incidence is the percentage of people that get a certain type of disease per year. Prevalence, on the other hand, is the total volume of people diagnosed with a particular disease this year, plus all the people diagnosed with that disease in previous years. There are multiple reasons why the prevalence of cancer is going up and making it evident that so many more people are getting cancer. One reason is because there are just so many more people on our planet. The size of our population is growing dramatically, so there are more people to get cancer. Secondly, the age of our population is also growing, and the older we get, the higher the risk of many cancers is. Now, with just these two population statistics alone, the World Health Organization is expecting a 70% increase in the number of people diagnosed with cancer across the globe in the next 20 to 30 years. So that's the population part of increased prevalence. Now, on the cancer care side, there are also two things that are driving increased prevalence of cancer, and they are both actually really good things. The first, death rates have declined for the four most common cancer types: lung, colorectal, breast, and prostate cancer. As a matter of fact, cancer death rates have been steadily decreasing over the last 20 years. They're actually down nearly 25% since the early 1990s. So more people are surviving cancer, pushing up the prevalence. Secondly, another good thing in cancer care is that the 5-year survival rate has increased significantly in the last 50 years. So people are living longer with cancer, also pushing up the prevalence of cancer. So when you add a bigger population and an aging population to longer survival and decreasing death rates, it creates a huge increase in the prevalence of people with cancer that we're seeing. So as individuals, such as we, get older, we become exposed to more and more people, and this increased prevalence becomes very evident. Ultimately, what it means is that all of us across the globe need to push cancer risk reduction and early detection practices, support our researchers, and push clinical trials to help us minimize this coming bubble of cancer diagnoses. In short, we need to make sure we do a good job of taking care of one another. Thank you, Janice, for your question. I'm Dr. Leslie Waltke, signing out from the recovery room. Let's talk again soon.